We decided to do our project on Nancy Roper. She contributed a part of the Roper-Logan-Tierney model for nursing.
This model is extremely prevalent in the United Kingdom and has spread into parts of the world, including the U.S.
Nancy Roper's model was based on that of daily living and sought to find out what living means for each patient.
While her model can be used throughout any part of the nursing process, Roper's intentions of her model focused most on the assessment portion.
This allows the nurse to focus on first assessing the patient and determining what is difficult for the patient to do on their own.
Her model allows the nurse to determine the patient's level of independence in regards to the activities of daily living.
This assessment then allows a more focused nursing care plan to be developed by the healthcare team.
These interventions will help the patient's independence as well as identify further support that would be required to compensate for their dependency.
Activities of living, as defined by this theory, promote maximum independence for the patient.
Nancy Roper's model focuses more on the patient's ability to function outside the hospital rather than the nursing theory to be used in the hospital. While their activities of daily living are important in the hospital, this model wants to make sure that once they are discharged, they are able to perform these activities of daily living independently.
Included in Nancy Roper's activities of daily living are maintaining a safe environment, communication, breathing, eating and drinking, elimination, washing and dressing, temperature control, mobilization, working and playing, expressing sexuality, sleeping, and death and dying.
For maintaining a safe environment, activities of daily living need to be done in a safe environment. This includes preventing accidents at home or during transportation, washing hands, and making sure the patient is able to safely function in their home. Also included in this section is a statement by Roper that says while we are affected by our environment, we also can affect the environment and need to take good care of it for the sake of the future generations.
Communication. A large part of human life revolves around communication. People communicate constantly, and according to Roper, it is a necessary part of the human experience. Patients must be able to communicate with those around them to allow for their needs to be met. This includes both verbal and nonverbal communication, such as speaking, writing, facial expressions, and body gestures.
Next is breathing. Breathing is necessary for human life. Life is dependent on the patient's ability to breathe effectively. Breathing allows oxygen to enter the body and carbon dioxide to leave the body and allows the body to maintain homeostasis. If the patient is not able to breathe effectively on their own, this must be medically treated before they are able to be independent again.
Eating and drinking. If a patient is unable to eat or drink on their own, they are not considered independent. This is a critical part of human life and is required to help maintain homeostasis in our bodies. The patient must also be able to effectively choose the right food and drink to make sure their body can stay in this balance. The patient must also be able to afford the correct food and drink, so their financial status comes into play in this section as well.
Elimination. This involves elimination of urine and feces. This should be a private activity according to Roper, and it allows the body to eliminate the necessary toxins from the body before they build up to high levels.
Washing and dressing. This is now called personal cleansing in an updated version of her theory. It is necessary for the patient to be able to wash and dress themselves on their own before they are considered independent. This involves washing of your body, hair, nails, teeth, and mouth, and perineal areas on a regular basis. This also includes the patient being able to wear appropriate clothes based on the weather and determine what clothing is appropriate for them to be wearing.
Temperature control. The body must maintain homeostasis, which includes a constant body temperature. If the body is too hot, hyperthermia can occur. If too cold, hypothermia can occur. The patient must be able to recognize signs of the body being either too hot or too cold and take actions to correct those temperature swings.
Mobilization. The patient must be able to move from location to location without too much difficulty. This requires both the use of large groups of muscles to allow the patient to sit, walk, and stand, and also smaller groups of muscles, which allow the patient to have fine motor function for manual dexterity and to show facial expressions.
Working and playing. Making sure the patient is able to have an income if needed to support their needs. Patients need to have a good balance of work and play in their lives. Stress from work can result in physical issues to their body from years of stress, but the patient still needs a source of income and a sense of purpose in the world to make their living.
Expressing sexuality. This includes not only sex and sexual activity, but also the patient's self-esteem and how they see themselves both physically and emotionally. The patient must have a good sense of self in relation to themselves and in relation to the rest of society.
Sleeping. Sleep allows the body to recharge and relax. It allows the cells in the body to grow, repair, and replace themselves so the body can be as healthy as necessary. Sleep is vital for all human beings, but especially those who are sick or have chronic health issues. A patient's sleep must be restful and not broken up by pain or breathing issues.
Death and dying. This includes helping the patient through the process of death and dying in the most comfortable way possible.
In addition, Nancy Roper believed in 5 factors that help make her model more holistic. Nancy Roper believed that without including these factors, the assessment of the patient would be flawed.
The first factor she includes is biological. An example of this is how having diabetes might cause the person's nutritional activities to differ from those of a person without diabetes. A patient with diabetes might have much poorer nutrition than a patient without, but this patient is also required to focus more on their nutrition than a patient without. Diabetes patients need to watch what they eat, when they eat, and how much they eat to make sure their body is as healthy as possible.
Psychological. One example of the application of this factor would be how having negative and depressive thoughts might influence the patient's ability to recover and improve their overall condition.
Sociocultural. In our society, it is expected for a patient of older age to start showing signs of cognitive decline. Caretakers and people around older individuals might assume that this is what is going on with the patient when there is really a physical problem causing their cognitive decline. This can lead to a slower delivery of care to fix that physical problem, or the care could be delivered at a lower level than necessary. It is important for us as a society of nurses to leave our biases at the door when treating patients to make sure they get the highest level of care they deserve.
Environmental. One example of the environment impacting activities of daily living is that of a person's home environment. Their home environment might not be clean enough and could increase the risk for possible infections.
Politico-economic. If a patient suddenly becomes eligible for housing assistance through the government, this can give the patient much more independence than they once had. If they are in a poor housing situation, some of their biological needs might not be met. Once they are given a new opportunity to have a better living situation, their other health issues might be easier to treat.